Could you just give us the picture? I mean, you're clearly somebody who likes hard work. While you are a minister in India, you also, during the pandemic, took the chairmanship of the executive board of the World Health Organization. Could I start with you with the question, what are the positives and what are the negatives that you've seen in the past year? And what do you see as the challenges and the hopeful signs looking forward?
I think if I could correctly follow what you asked me was that what is the greatest challenge right now for restoring this cross-border movement of people and various goods and of course other things. You see, the COVID-19 pandemic, it has gravely wounded the world economy with serious consequences, impacting all the communities all across the world and individuals. It has also hit supply chains and it has therefore impacted trade and development in a major way. Moving rapidly across borders along the principal arteries of the global economy, the spread of the virus has benefited from the underlying interconnectedness of globalization. In the context of public health, I would, since I look after health and science and technology, I will be focusing more on the public health side of it. And I would say that in the context of public health, clear, transparent, and timely sharing of crucial information on public health emergencies by undertaking rapid risk assessment and disseminating the risk. This is the key to striking a balance between public health and trade and also travel. Conducting such risk assessments would entail rapid analysis of causative agents, their origin and transmission dynamics, geographic spread, the pathogenicity of the disease, the population and age groups which are affected, the associated fatality, the potential impact on health, livelihood, and also the economy. Additionally, it is imperative to have standard operating procedures to streamline operations of international contact tracing also. In the context of COVID-19, detection of mutant variants in some of the countries, which has led to resurgence in cases, this has emerged as another impediment in dialing down the existing travel and trade restrictions that countries have put up in a bid to restrict the spread of COVID-19. So, although we have to ultimately develop the mechanisms, from where we were 1 year back, I think a lot of things have improved further. But certainly, we have to act with a lot of patience also and with a lot of meticulous precision and vision and take care of the whole issue in a very, very, I would say, dedicated, sincere, committed, and scientific manner.
How do we solve, though, the kind of problem that Sabrina is talking about with India, 1 billion people? How do you get them all integrated? And then how do you solve the challenges of cross-border mobility?
I would like to offer my comments on the situation existing right now, where we stand, whether it is in India or anywhere else in the world. Though the International Air Transport Association and a few countries in Europe are already pondering on the idea of a COVID-19 vaccination-based immunity passports or a travel pass in a bid to ease travel restrictions. I personally feel, and I would say that all the medical professionals and scientists will also have the same feeling, that it is a bit too early to talk about the same. Though clinical trials have already suggested that the vaccines are effective at preventing one from getting seriously ill, there are still, you see, critical unknowns, such as we really don't know whether about the efficacy of the vaccination in reducing transmission, also the duration of immunity after vaccination, and also the efficacy of the vaccine against the emerging variants of SARS-CoV-2 virus, etc.
So just to be clear, Minister, so you think it's really too early to talk about vaccine passports as they're known?
You see, I think in view of the above that I mentioned just now, we are of the view that we may have to wait for some more time for evidence to emerge to take further decision on this matter. Further,
how soon do you think that would be? How quickly do you think we could get to a point where there's an integrated system?
I think, you see, further as regards your question on the standardization of these implementation frameworks and all, whether for sharing of crucial information on public health issues, I must say that it is the international contact tracing or immunity passports that shall ultimately hold the key to ensure their international acceptability. Such frameworks should be used on sound principles of equity and privacy. And I personally feel right now, being the director of the executive board of WHO, that WHO as a UN body can play a lead role in achieving a global consensus on such frameworks. And then I would say that developing such cross-border mobility experiences will require cooperation between the health sector as well as aviation, travel and tourism sector stakeholders. Still,
and is one of the issues for you, and you're dealing with, as we know, more than 1 billion people, is one of the issues for you ensuring you have the trust of your people?
You see, we have enjoyed the trust of 1.35 billion people in a big way, and under the leadership of our Prime Minister Narendra Modi ji, you see, the whole country and the whole society stood like a rock behind him. Yeah. And every appeal that was made, so the whole country has a lot of confidence in what the government does, because we have involved everybody. It has been a total government, total society, and everyone in the society, all stakeholders, whether the industry, corporate sector, scientists, professionals, everybody has been on board. Yeah. So
go on, finish up, please.
So I feel that such changes will certainly require a coordinated, harmonized approach, and it has to be a global scale as the pandemic itself. Definitely, I think that timing is of the essence to prevent further harm to economies. Yeah. And make travelers comfortable with travel.
Understood.
And of course, from the scientific side, I would say that recognizing that scientific consensus around testing and immunization is not yet mature enough, and that global guidance around testing has yet to be developed. There is an urgent need to design a flexible model that can help us move past the current fragmentation, and that can evolve and adapt as the science matures.